Hello, welcome guys, and today we will be seeing the memory-based recalls for May INI-CET 2026. So first of all, first patient, the pediatric patient with severe scaly patches alopecia with broken black dot hairs and scalp scaling. So the diagnosis was tinea capitis. Now patient with dark hyperpigmented scaly black colored mass on the heel. Initial diagnosis bedside test to differentiate fungal from the melanoma. So options were skin biopsy, KOH, gram staining. So KOH can be done to differentiate fungal from melanoma. Now newborn presents with widespread painful erythematous rashes with superior blisters and but mucosal membrane was not involved. So what is the diagnosis? So SSS syndrome, that is staphylococcal scalded skin syndrome, because this toxin will target the desmoglein 1 that is absent in the mucosa. That is why it is not involving the mucosa. Now, which condition? This is false negative Nicolsi sign positive seen in that bullous pemphigoid, that is subepidermal blistering will happen in this. This is the correct answer. Other options were pemphigus vulgaris and Steven-Johnson syndrome. Now, drug of choice to abort an episode of malignant melanoma, that is IV dantrolene. Target sign, Donut sign on a high definition ultrasound of right iliac fossa. So that is seen in two conditions, acute appendicitis or can be seen in intussusception also. Now immediate mandatory step when evaluating acute suicidal patient in emergency. Now what has to be done to secure inpatient, that psychiatric hospitalization, and continue supervision and ensure the safety of the patient. This is the answer. Now, primary clinical objective for damage control orthopedic, that is DCO, in polytrauma. So first temporary stabilization will be done using the X-fix and not internal fixation. Now most common bacterial pathogen, that is neonatal meningitis in 6 weeks old infant. What is the most common? So group B streptococcus is the most common in 6 weeks old infant, causing neonatal meningitis. Now neonate presents with generalized flaccid bullous skin lesions. Immunofluorescence auto antibodies are positive. So neonatal pemphigus vulgaris is the answer. This is clear cut one liner. Now 20 months old infant, a normal language milestone will be 10 to 15 meaningful words and it joined 2 words sentences. So this is the normal language milestone of a 20-month-old infant. Now neonate, which is marked hypotonia, refractory seizures and evidence of very long chain fatty acids, VLCFA. So that is Zellweger syndrome and that is paroxysmal biogenesis disorder. Now pathophysiology, mechanism of secretory diarrhea in relation to CTFR channels. So what happens that overactivation of the CTFR channels will lead to chlorine secretion that will drag water from the intestines, so it will cause secretory diarrhea. Now maternal transmission of anti-RSS antibodies is classically linked to severe cardiac anomaly. So that is congenital neonatal complete heart block. Valid consent for MTP in rape survivor. So only the woman can also give the valid consent if the age is more than 18 years. So no additional consent from the parents are required. Now clinical findings of Trichomonas vaginalis, strawberry cervix, alkaline vaginal pH of 4.5 and motile flagellated trichomotes on wet mount is seen. Now first immediate line of management for expanding postpartum vaginal hematoma. So surgical incision, evacuation of the clots and meticulous ligation of the bleeding vessels should be done for the expanding hematoma. Now diagnostic parameter, clinical to confirm androgen insensitive syndrome, that is AIS. So 46XY karyotype with female phenotype and inguinal testis will be seen, then normal testosterone levels will be seen. Incorrect priority orders of ATLS polytrauma management. So circulation, airway, disability, and stop a hemorrhage. So first stop a hemorrhage, after that you secure airway, then circulation, and last disability. Oncology principle of TME, that is total mesorectal excision. So en bloc removal with surrounding lymphatics should be removed. Now dietary lifestyle is for ileal volvulus. So ileal volvulus, high fiber diet is very much risk for ileal volvulus. Now typical post anatomical extension limit of the standard rectocele repair, that is 2 to 3 centimeter. Sphincter sparing complex surgery for complex or high fistula in ano management, that is lift, ligation of intersphincteric fistula tract or mucosal advancement flaps. Multiple movement disorder with dystonia with basal ganglia involvement, which conditions require the different strategies. So dopa responsive dystonia, that is SEGA1 disease. This responds to low dose dopa is the answer. So prominent abdominal striae with no history of corticosteroids intake. What is the next step in management? So overnight 1 mg dexamethasone suppression test or 24 hours urine free cortisol should be done. Following condition least likely to be independent risk factors for elderly patient false. So hearing loss is the answer for this. Balance deficit, muscle weakness, and osteoarthritis are the other options. Patient with melanoderma telangitis and cystic sclerosis, which valvular heart disease is observed. So tricuspid regurgitation secondary to pulmonary artery hypertension, that is PAH, is seen. Now, lady traveled to Assam, developed severe lung disease. What is the diagnosis? So, melioidosis. This is Burkholderia pseudomeli is the answer. Now, HIV positive patient present with neurological deficits. Brain imaging reveals multiple ring lesions to the basal ganglia on CT or MRI. What is the diagnosis? Cerebral toxoplasmosis is the answer. Now, triad seen in primary hyperparathyroidism, that is hypercalcemia, hypophosphatemia, and increased PTH, serum PTH, that is parathyroid hormone. Medical condition which shows low serum lipid profiles and least hyperlipidemia, that is A beta lipoproteinemia. That is the correct answer. Now muscles of palate supplied by V3, that is mandibular nerve, and other nerves are supplied by pharyngeal plexus. So which of the muscle is this? So this is tensor valley palatini. Now male with vascular nasal cavity mass, recurrent epistaxis, bony invasion, what is the diagnosis? So angiofibroma is the diagnosis because that is juvenile nasopharyngeal angiofibroma. Now, which vitamin plays a role in transaminase reactions? So pyridoxal phosphate will be the correct answer. Now enzyme seen active in dephosphorylated state, that is glycogen synthetase. Insulin mediated glucose uptake via transporter, so that is GLUT4 transporter in liver. Primary medical research application of CRISPR Cas9 system, that is gene editing tool, which yields negative Benedict test. Sucrose yields negative Benedict test. Special HP stain to highlight liver fibrosis. So Mason trichome is that special stain. Which inflammatory cells dominate MI zone between 12 to 14 hours post infarct? So neutrophils are the dominant ones, dominant inflammatory cells in 12 to 24 hours. Calculate the total Gleason score and determine the grade group for a prostate biopsy. So primary pattern is 4, secondary pattern is also 4. So 4 plus 4 is Gleason score will be 8. Now diagnostic hallmark and a standard approach for post-streptococcal glomerulonephritis, that is PSGN. So clinical correlation with low C3 levels and elevated ASO titers and anti-DNS B. The following is classified as novel antidepressant with multimodal activity. So the answer is vilazodone. Which statement represents correct clinical guidance regarding nicotine replacement therapy, that is NRT, and smoking cessation? So varenicline can be used. It is the first line non-nicotine therapy that is used. Now lamotrigine, clinically indicated broad spectrum agent, highly effective in specific seizure type, that is tonic-clonic seizure type. Now, primary immunological mechanism for toxic shock syndrome, toxin 1 superantigen. So, non-specific cross-linking of MHC class 2 molecules with T cell receptors, that is lead to cytokine storm. So, male patient with 3 to 4 painful vesicles and glands and shaft of the penis, which sexually transmitted infection, that is herpes genitalis HSV2. Painful papules lesion on the scrotum. What is the most likely causative agent? That is also HSV2. Now, molecular mechanisms of action of diphtheria lesions. So, ADP ribosylation of EF2, that is inhibiting the cellular protein synthesis. This is the molecular mechanism. Now, presence of grease collar, dirt collar around wound indicate the foreign villus, that is distal gunshot entry wound. Distant. Okay. Then patient presents with signs of retrobulbar neuritis, positive. Relative afferent pupillary defect is present. Normal optic disc. So retrobulbar neuritis with inflammatory pathology. Now drug latanoprost, it decrease intraocular pressure, promotes aqueous humid drainage. How? Uveoscleral outflow pathway, not trabecular pathway. So it activates uveoscleral outflow pathway. Now lap hernia, how many centimeters from the pubic tubercle repair? So it is 2 centimeter. Malar telangiectasia with scleroderma with valvular disease, that is mitral stenosis. Now image-based question was there and answer was thymus gland. It was given. Not a feature of Kawasaki disease, that is purulent conjunctivitis. It is not a feature of Kawasaki disease. 3 images, cafe all out spots and swelling in the eyelid. So what does it indicate? Which disease? This is neurofibromatosis. Larynx image was given and posterior cricoarytenoid was marked in it. Refeeding syndrome, most pathognomonic. Which metabolic abnormality will be there? Hypophosphatemia will be there. Now 16-year-old girl with 16 weeks pregnancy, what needs to be done? Fetal biopsy. What needs to be done? Accept. Okay, so fetal biopsy for DNA should not be done in 16 weeks. Now nicotine replacement therapy, caffeine avoided 15 minutes before nicotine gum for maximum oral absorption. Now patients treated for TB in past, MRI image shows spine lesions. What is next? So needle biopsy for the lesions should be done. That is the next step. And hemoglobin is 8 grams, MCV is 38, low ferritin is there. What kind of anemia it is? So it is iron deficiency anemia. Match the following. So metformin will be formed by ample pathway and resveratrol, SRIT1 pathway will be the correct answer. Now GB is non-tender palpable, jaundice is positive, pruritus is positive. What is the diagnosis? This is the CA pancreas. Now meningitis in child of 6 months, not a cause. So listeria will not be a cause for meningitis in 6 months old child. Now intoxication, patient management. 1, hypertension, low heart rate, pupils pinpoint. What is the treatment? Naloxone should be given for intoxication. Now enzymes help in formation of primer. So primase enzyme helps in formation of primer. GCS, so eye opening to pain, localize pain and respond to sound. So that will be 9. 9 is the correct answer. Now 26-year fell from bike, swelling and feeble pulses in leg and now in the foot also. 3 IV doses, pain relievers and everything given. Still it is missing in the foot. Compartment syndrome is been detected by the resident. What is the management? Management is immediate fasciotomy should be done. Now 4-year-old child with history of injury in childhood, blood test normal, vellus deformity, X-ray tibial involvement and left lower limb is genu-varus. So what is the defect? Posterior tibial defect is the answer. Now child with fever, malaise and cranial palsy, hydrocephalus, and low glucose, high protein. That these two things are very important. Low glucose and high protein that leads to TB meningitis. Now 12-year-old with URTI, which of the following investigations is necessary? So answer was nothing is necessary. That is the appropriate answer for that. Image of stool sample microscopy and Ascaris X was the answer for that. Primary amenorrhea, so that is MRKH, Mayer-Rokitansky Kuster-Hauser syndrome. Now Melkerson-Rosul, that surgery all except that syndrome involves all except ptosis. Then much of the following: clarithromycin matched with the chlamydia and streptomycin matched with the MTB. Now inferior oblique muscles and structures formed by it was marked, so that structure was marked was conjoined tendon. Now G2P1 female, previous history of preeclampsia, management according to the time, BP is within normal limit, no proteinuria. So start low dose aspirin at 12 weeks of time. Now Pearl index formula, this is very easy one liner. Number of pregnancies and divided by total month of exposure into 1200 is the Pearl index formula. Longer duration of action of which drug? So clopidogrel was there. This is the correct answer. Tattoo in ink site, which layer it is deposited? So dermis is the correct answer. Sparrow feet sign on the face, that is after artery history. So what is the diagnosis? Basilar skull fracture. Now image of a baby with no fever, epidermolysis bullosa was given the option. It was the correct answer. Which of the following is correct about the diphtheria toxin? That is AB exotoxin is produced. Flank pain in lady, what will the investigations? So USG followed by CT scan to rule out any kidney stones. Achilles tendon, that image was given, the tear, so that sign was given, the Thompson sign was given. That is the correct answer. Diagnostic hallmark PSGN, so that is low C3 and elevated ASO. That is the correct answer. Now amplitude of accommodation at 14 degree. So normal childhood physiological state is the correct answer. Now biphasic flow in right coronary arteries due to low pressure in the right ventricle. This is the correct answer. Now increased permeability of the glomerular capillaries. What will be increased in urine? So protein secretion will be increased in urine. Now renin secretion is in response to what? So increased sodium loss due to macula densa is the trigger for renin secretion. Then hyperpolarization during sensory transduction, that is visual receptors. Emotional prosody of speech function of which area? That is brain area, that is cingulate gyrus. Cell junction that was present in the image, that is the gap junction. And which brain area neurons can regenerate and increase in number? That is dentate gyrus. Remnant of embryological hindgut found in rectal area gives rise to chondroma. Now image based question, that cleft palate was given, view classification was given. Now adrenal medulla and neural crest cells, this is the match of the following. In kidney it was matched by inferior mesoderm and thyroid endoderm. Now Burns is classified as 4th degree quaternary injury, not first, second or third. Now 5-year-old progressive loss of eye contact, rapid clapping movements and slowing of the head growth, development regression. What is the syndrome name? What is the diagnosis? Rett syndrome is the correct answer. And histology was given, and salivary gland, that was salivary gland assignee, that was the image given. And one more question, I can't recall the answers for the reversible inhibitors of acetylcholine esterase. If you remember the options, please comment below and we will find the answer for that. And stay tuned.